Hi, and welcome to today's webinar. I am Chris Gilmore. I'm a Senior Wealth Manager at Stansberry Asset Management. And today's topic in our ongoing webinar series is Protecting Your Health, which is a discussion of long-term care and Medicare. I want to thank you for joining, and I hope that you find the commentary valuable and informative. As a reminder, we have a variety of webinar topics ranging from tax-related issues and investment strategies to estate planning and alternative investments. If you want to view any of these, please feel free to go to our website at stansberryam.com, and under the Insights tab, click on Videos to view past webinars. That said, today we'll focus a little bit more on insurance solutions to be aware of as you approach retirement. Let's kick things off with a discussion that summarizes some of what you should be aware of related to long-term care. Long-term care is an insurance solution that is used to provide a range of services and support that help people with chronic illnesses, disability, or cognitive impairment when they either can no longer perform everyday activities on their own. It's different than Medicare. It is not a medical care. It is not medical care in sort of the more traditional sense, like a doctor's visit or hospital care, but rather pays for assistance with daily living. It can provide services in home, in an assisted living facility, in nursing homes, in memory care units, across a variety of different institutions. For those with long-term care insurance, they become eligible for their benefit when they're unable to function independently around really two primary categories. The first of these categories are what's referred to as the 6 activities of daily living, which include bathing, dressing, eating, using a toilet, transferring to or from a chair, and continence. Another category, the second category, is the instrumental activities of daily living, or the IADLs, which are more complex tasks and can influence coverage decision. So they influence. They're not mandated in much the same way as ADLs are. But these items are managing money, preparing meals, housekeeping, shopping, taking medication, using transportation, those type items. To be eligible for long-term care benefits, the beneficiary needs to require help with at least 2 out of 6 of the activities for daily living, or has a severe cognitive impairment like Alzheimer's disease or dementia. Ultimately, eligibility is going to be based on a doctor's certification and the insurer's requirement. So if you or a loved one are having difficulties with any of these activities of daily living, and you have long-term insurance, I would strongly encourage you to contact your doctor or insurer to explore eligibility with those entities. So let's back up for a moment here. As an individual gets older and increasingly has health-related issues, what are your options for cost coverage? Well, they obviously include self-funding, which is paying directly from savings, investments, home equity, but any of these can rapidly deplete your assets. So, it's not usually the most popular unless you have a high level of wealth. Then there's what we're talking about here, private long-term care insurance, which is typically purchased in advance, usually in the 50s or 60s, and that can somewhat reduce costs. It comes with an elimination period. Premiums can be quite high and will vary by age, your health, the coverage amount, and the duration of the elimination period, which I'll get to in a moment. Hybrid policy, life insurance with long-term care rider or annuities with long-term care benefits. Now, what's nice about these is that if you don't end up using the long-term care, your heirs get a life insurance payout, which is popular. At least there's some sort of expected payout. And then the last option is Medicaid, which is the largest, frankly, payer of long-term care in the U.S. and can cover nursing home care and in many states home and community-based services. So keep in mind that Medicaid is only available once you spent down your assets to meet strict financial eligibility requirements. Now, similar to a deductible in the world of insurance, long-term care has something called, as I mentioned a moment ago, the elimination period, where a deductible is a targeted dollar amount you must satisfy. The elimination period is measured more in time. The elimination period is the time after a person is deemed eligible for long-term care benefits, but before they are eligible to receive those benefits. And it can range in duration. Typically, it's anywhere from 30, 60, 90 to upwards of 180 days after that person qualifies. During this time, the policyholder pays for care out of pocket before the long-term care coverage kicks in. Like a larger deductible, choosing a larger elimination or longer elimination period will usually lower your premiums. So there are strengths and weaknesses related to long-term care. Some of the strengths: it protects savings from being drained by nursing home or in-home care costs. It provides flexibility. It can cover home care, assisted living, or a nursing home. It offers peace of mind to family members, which can't, you can't really put a price on that. But weaknesses are expensive premiums, especially if purchased later in life. In fact, in my experience, that's where most folks hesitate to keep so you want to keep in mind, should you choose to invest in long-term care, premium costs will add up. I will say that if you're fortunate enough to have an HSA or a health savings account, the IRS does allow you to use that pre-tax money to pay premiums up to a limit. This limit is varies, but it's based on age. In 2025, it was around $4,800 that you could use towards these costs for those that are 55 and older. If interested, I'd suggest talking to your CPA about it. Now, as is true with all insurance, if never used, benefits may feel wasted, so that's also a downside. Insurers can also keep in mind premiums are not static. They can and will be raised over time. Some policies also have daily or lifetime caps, which may not cover all costs. So if you are exploring long-term care coverage, make sure to ask. All right, let's move on to Medicare now. So Medicare is a federal health insurance for individuals 65 and older, not for families or spouses, and some people under 65 with certain disabilities or conditions. The initial enrollment period begins 3 months before you turn 65 and ends 3 months after your birthday month. If you miss this window, don't. You may face penalties or delays in coverage. Now, to apply, you can go online at www.ssa.gov, and you can apply in person or you can call and they can walk you through it. Any one of those options is good, though you might struggle with bureaucracy in some more than others. You'll need your social security number. You'll need your birth certificate. You'll need proof of U.S. citizenship or legal residence. You'll need information on your current health insurance, if any, if you have any. And you need bank details for premium payments. Medicare is administered by CMS, which is the Centers for Medicaid and Medicare. Actually, I believe it falls under the U.S. Department of Health and Human Services. What about people that qualify prior to age 65? Importantly, individuals under the age of 65 with certain disabilities may also be eligible for Medicare coverage. Specifically, if you are already receiving Social Security disability benefits, you will qualify for Medicare benefits. To access Medicare under 65, it's not going to be automatic. You need to apply for Social Security Disability Insurance, SSDI. SSDI is designed to provide financial assistance to workers who become disabled and can no longer earn a living. The program is funded through payroll taxes and collected under FICA and is part of the broader Social Security system. So, importantly, Medicare is the insurance that covers healthcare cost, and SSDI is financial assistance. To determine eligibility, you'll need to provide documentation proving your disability and how it affects your ability to work. Once you're approved, your benefits usually begin within 5 months of when the disability began. Assuming you are approved for SSDI benefits, you will automatically be enrolled in Medicare Part A and Part B after 24 months of payments. If, however, you qualify due to ALS, unfortunately, or end stage renal disease, you will receive Medicare coverage much sooner. With both ALS and ESRD, you are eligible for Medicare, allowing you to bypass that 24-month waiting period that I just mentioned. Now, there are a number of other conditions that may be eligible for Medicare earlier, including certain types of cancer or respiratory conditions, mental health disorder, cardiovascular issues. To find the official list, I would suggest going to CMS website or the Social Security Administration website. So, continuing with Medicare, you've probably heard of Part A, Part B, Part C, and Part D. Well, let's go through each of these and get a better sense of what they are. Medicare Part A is insurance for inpatient hospital visits. It covers hospital care, semi-private rooms and meals, which is nice, skilled nursing facility care, hospice for the terminally ill, and some home health services such as intermittent nursing and physical therapy. It does not cover outpatient services or prescription medications. Those will be addressed in a moment. Eligibility for premium-free Part A is typically based on having worked and paid into Medicare taxes for 10 years or 40 quarters. If you have not worked for the required amount of time, you may still be eligible, but you'll get a discount over the premium versus it free, like the folks that are eligible. And it's going to be based on the number of quarters you have worked. If ineligible, consider private health care options. Medicaid may be an option. There are also state-specific programs, or consult with a healthcare professional that may have additional insights. I would keep in mind that in many cases, Medicare is premium free. There are deductibles and coinsurance, though, so it's not, you don't get off completely with respect to getting the free Part A. In 2025, Medicare Part A covers inpatient hospital stays for up to 90 days within a benefit period. The first 60 days are covered after the $1,676 deductible is met. For days 61 through 90, a daily coinsurance of $419 applies. After these 90 days, individuals having additional lifetime reserve, they have an additional lifetime reserves of 60 days. It can be used once in a lifetime and currently costs $838 a day, so not inexpensive. These reserve days are exhausted once used, and a higher daily coinsurance applies to them. If an inpatient hospital stay extends beyond this 90-day period, and all the 60 reserve days have been used, Medicare Part A will no longer cover the cost for that benefit period. If your doctor decides that you need skilled care, like an IV, rehab, wound care, or therapy, after a hospital stay of at least 3 days, Medicare will pay up to 20 days of Medicare approved, I should say, at a Medicare approved skilled nursing facility. For days 21 through 100, you'll be responsible for the daily $209.50 currently. After day 100, Medicare pays, again, nothing. A Medicare benefit period is measured by your use of inpatient hospital and skilled nursing facility services. If it starts, it basically starts the day you're admitted as an inpatient to a hospital or a facility and lasts until you have not received inpatient hospital care for at least 60 consecutive days. This means that if you are hospitalized again after this period, a new benefit period will begin. So that covers Part A. Let's move on to Part B. Part B is medical insurance. This part requires a monthly premium which varies based on income and is generally taken directly from your Social Security. Enrollment in Part B is necessary to maintain Part A coverage if you are paying for it. Part B helps cover a variety of medical necessary services and supplies, which include outpatient care. This includes visits to doctors, specialists, and outpatient clinics. Services such as diagnostic tests, emergency room visits, if you're not admitted, and outpatient services are all covered. Part B also covers many preventative services aimed at early detection and prevention of illness. This includes annual wellness visits, vaccinations like flu shots and COVID vaccines, and screenings for conditions such as cancer and diabetes. Part B also covers durable medical equipment. What is that? Well, it's things like wheelchairs or oxygen equipment, blood sugar monitors, that sort of thing. Premiums for Part B is based on your current level of income, but in addition to the premium, there's also an annual deductible. Currently, it's $257, as well as a 20% copay with no cap on your out-of-pocket. So do keep that in mind. For most people on Medicare Part B, the monthly premium in 2025 will be $185. But if your income is on the higher side, you might end up paying a little bit more, thanks to something called IRMA, which stands for Income Related Monthly Adjustment Amount. It's basically an extra charge added to your regular premium if you earn above $106,000 in 2025. So, IRMA can affect both Part B and Part D, which we'll get to shortly. It has a 2-year look back, which you should keep in mind as well, which means that the Social Security Administration considers your income from the last 2 years when determining if you owe IRMA surcharge. So let's take a look at this chart here. You can see basically at $106,000, you pay $185. If you creep up above that number, there will be an increase in your Part B monthly payment, and you'll also pay another $13.70 for your monthly premium related to Part D. If you make between $200,000 and $500,000, your monthly premium for Part B will be nearly $600, $591, and there will be an additional charge related to Part D of $78.60. So it's certainly something that you want to keep abreast of. That is a breakdown on Part B. Let's move to Part C. So, Medicare Part C or Medicare Advantage is an alternative to the original Medicare Part A and Part B, which we just reviewed. It is offered by private insurance companies that are approved by Medicare. To be eligible for Part C, you must be enrolled in original Medicare, Part A and Part B. You must live in the service area of a Medicare Advantage insurance provider offering the coverage and price that you want. These plans provide all the benefits of Part A, hospital insurance, and Part B, which is medical insurance, and may actually include additional services such as vision and dental, hearing coverage, perhaps prescription drugs, as well as some wellness programs. Importantly, Part C can be either HMO or PPO, and may have certain limitations related to that. As a network-based solution, it requires beneficiaries to use healthcare providers within a specific network to receive coverage. The network includes a group of doctors, hospitals, other healthcare providers that have agreed to accept the plan's term. If a beneficiary visits an out-of-network provider, much like if you were to do that while under regular insurance and you're unable to get authorization, you may be responsible for the full cost of the service. So keep that in mind if you do, have a favorite doctor. This network-based approach allows Medicare to control cost and ensures that beneficiaries receive care from providers who accept the plan's terms. So that's about it for Part C, but do keep that in mind. Part D, many folks are familiar with this. This is related to prescription drug coverage. Medicare Part D is really a federal program run through private insurance companies approved by Medicare that can help cover the cost of prescription drugs, including many generic and some brand name medications. Available really to anyone enrolled in Medicare Part A and Part B, or can get bundled into Medicare Advantage, which is Part C. Similar to other Medicare programs, the enrollment period lasts from 3 months prior to your 65th birthday until 3 months after. Make sure you include Part D in your planning, as there are penalties if you miss this window. The premiums can cover drugs but the coverage might vary by plan, so you want to shop around. Generally speaking, the monthly premium, it will vary by plan. But annual deductibles, some of the plans have, but don't have an annual deductible, but some do. I'll say most do. But what's nice is that it's capped at $590 in 2025. Co-pays, after reaching that $590 deductible, you'll have to pay 25% drug costs up to $2,000. When you reach that $2,000 max, which is important, there is no cost for covered drugs for the rest of the year. This was part of the Inflation Reduction Act back in 2022, which was, I'll say, a nice change. There are 3 Part D enrollment periods, which include the initial enrollment period, first day of the month, 3 months before your 65th birthday, or the date of your original Medicare coverage when it becomes active. It ends on the last day of the month, 3 months following your original Medicare active date. But there's also this special enrollment period, and this occurs when certain events happen in life. Special enrollment period gives you a chance to make changes to your Medicare Part D plan, or enroll in the outside of the typical enrollment period. Triggers include changing where you live, becoming eligible for new coverage outside of Medicare, or perhaps losing your current coverage. Then, lastly, there's the annual enrollment period. Now, the annual enrollment period occurs each fall from October 15th to December 7th. If you delay Medicare Part D and do not have credible drug coverage, this is your chance to enroll in a prescription drug plan that for the following year. During this time, you may also change your prescription drug plan or drop prescription drug coverage altogether if that's your wish. Word to the wise, do stay on top of Medicare coverage as the costs can change annually. Review your options to determine what those changes might be and the impact to you. You can do that, and you can amend your Medicare coverage again between October 15th and December 7th each year. Just to give you a sense of some of the more recent changes, Medicare Part A and Part B premiums, deductibles, and coinsurance have all gone up in 2025. So you would want to be aware, not rudely surprised by that. What is nice, though, is that they have capped the Part D copays and coinsurance at $2,000, which I mentioned a moment ago. Medicare covers more behavioral health care, which is nice, is in addition to cardiovascular risk assessments, which is a beautiful thing. So, as we go through each of these elements of Medicare, there's a reoccurring theme related to potential for meaningful out of pocket expenses. How do we mitigate these? An option might be Medigap. Medigap is a private insurance sold by private companies to fill the gaps in original Medicare coverage, Parts A and Part B, such as deductibles, copays, coinsurance. Likely, if you want this sort of coverage that Medigap provides, enroll in it when you first become eligible. Like other Medicare related solutions, delaying enrollment can limit eligibility and increase costs, especially if you have pre existing conditions. Actually, by enrolling when you first become eligible, you avoid having to go through the underwriting process later. If you enroll late, you'll be required to go through that underwriting process. Importantly, it helps to cover a variety of out-of-pocket expenses, including copays, coinsurance, and deductibles. It is only available with original Medicare Part A and Part B, and not available with Part C. There are a number of plans. They range from Plan A to Plan N to Plan G, but generally that last one is the most popular, so let's touch on that. Why is Plan G popular? Well, of the Medigap coverage, it's the most comprehensive, with coverage for Part A coinsurance and hospital costs, and adds up to an additional 365 days. Part A deductible is taken care of. Part B coinsurance and copays are taken care of. Part B excess charges up to 15% for non-assignment doctors, so that's kind of a nice to have. Skilled nursing facility care, coinsurance is taken care of. Hospice care, coinsurance, copayment, those type expenses are taken care of. You get the first 3 pints of blood. 80% of foreign travel emergency, again within the plan limits, are covered. It does not cover the Part B deductible, nor services not covered by Medicare, like dental, vision, prescription drugs. You may also be interested to know that this can also be found in a high deductible plan, which may reduce overall cost to you. So similar to a high deductible plan, it can reduce the cost related to Medigap coverage. So let's review some of the strengths and weaknesses of Medicare. Strengths, broad coverage for seniors. That's a hard age group to get coverage for in more traditional insurance type ways. It offers choices in plan options. I will say our healthcare industry is struggling, so to have guaranteed acceptance at age 65 gives great peace of mind. A reminder is you will have to have worked for 10 years or 40 quarters to get Part A free. The weaknesses, there's really no cap on out of pocket cost for original Medicare. If you consider the cost of inpatient care, which can be quite significant, Part D is fairly complex and there are coverage gaps. Advantage plans may restrict provider choices. You have the in network and out of network, and that can be complex, and you want to make sure you have access to the doctors you want to have access to. And it doesn't cover long term care. So, as we wrap up, let's quickly revisit some of the key differences between Medicare and long term care. Medicare is a federal health insurance for people 65 and older, and some people under 65 with with certain disabilities or conditions. If you're approaching age 65, keep in mind that the initial enrollment period begins 3 months before you turn 65 and ends 3 months after your birthday month. If you miss this window, you may face, again, the recurring theme, penalties and delays in coverage. Long-term care, entirely different. Long-term care is not a medical care, or is not medical care in the traditional sense, like doctor visits or hospital cares, but rather pays for assistance with daily living. It's an insurance solution that is used to provide services and support that help people with chronic illnesses, disabilities, or cognitive impairment when they can no longer perform everyday activities on their own. Medicare coverage will generally pay for acute treatment for a sudden illness, injury, flare up of a chronic condition that requires immediate medical condition. The goal with Medicare is to stabilize you, to treat the condition and discharge you once you are medically stable. It's not a long-term residence type situation. Long-term care, on the other hand, is coverage and is more custodial in nature, if you will. It's a non-medical assistance with everyday activities that you might otherwise be able to do. It does not cover a licensed medical profession. It's more for caregivers, for home health aid, for facility staff that can provide it. The focus is on helping you live kind of day to day, not on treating or curing a medical condition. Medicare will occasionally pay for nursing home, but it is generally only short term in nature, which we talked on earlier. Coverage is only within a skilled nursing facility after a qualifying hospital stay of at least 3 days. And to be eligible, skilled care might include something, along the lines of IVs or extensive wound care, rehab therapy, monitoring by nurses or therapists. Long-term care is specifically designed to help pay for services that Medicare does not. If you need to live in a nursing home because you can't perform activities of daily living on your own, which we talked on, bathing, dressing, eating, toileting, transferring from a chair and back, continence. Long-term care insurance should pay a daily or monthly benefit amount towards that cost. Keep in mind some policies have a maximum benefit period, like 3, 5, or potentially unlimited years. So it may not be everything you want. You just want to make sure that it's going to satisfy your particular need. Who pays for medical Medicare is paid for by the federal government, right? Long-term care will be paid by the insurance company or, if eligible, Medicaid. Lastly, what makes you eligible for Medicare and long-term care? Well, as discussed, at age 65, you become eligible for premium-free Medicare if you have worked the requisite 10 years or 40 quarters. To be eligible for long-term care benefits, the beneficiary needs to require help with at least two of those six ADLs, activities of daily living, or have severe cognitive impairment like Alzheimer's or dementia. Keep in mind that ultimately eligibility is based on a doctor's certification and coverage by the insurance company. So, as a firm, Sam is dedicated to providing you with investment management, but also holistic financial planning, including being a resource to you as you approach retirement and requisite assistance related to Medicare and long term care. Please know that you can reach out to us at any time and that we will be a trusted resource. For existing clients, please feel free to connect with your wealth manager to begin that dialogue. For individuals considering Sam's services, please contact your business development representative at www.stansberryam.com or simply scan the QR code, which you should see on the screen in front of you here. That said, I want to thank you for joining us today for our discussion of long term care and Medicare, and I hope that you found this information helpful. Have a wonderful day, and I look forward to talking with you again.